try to put the knee in these tack positions. 20 seconds, knees of flexion. So you can use a hot pack roll or just as well as anything else.
If you slide on one more time.
Whatever you use to help position a patient, make sure it's not in the plane of treatment, so it's blocking your glides, okay? All right. And try to take turns using the mobilization belt, guys. So share it around the table so you can get used to how it works and how it feels.
Ain't nothing to record.
You go on the table.
Orange ticket.
All right. All right, so we're going to do some distractions, posterior and anterior glides of the tibia, as well as, we might go ahead and do the patellomoles are really, really easy, and some proximal fibula glides as well. Follow here. So, we have the position lined up, and to do your distractions, you're going to come down around the ankle, and your force is kind of like pulling down and towards the floor. So it's not a straight force, it's almost down, inferior, and towards the ground, okay? So, pull. And relax, okay? That's my core. Core is here, and then I let off just a little. At the end, and a little. Okay? So if I wanted one, it would be just barely taking up slack and easing off. And two would be from the beginning of one into the middle. And back. Three is in the middle, and then towards the end, and then back off. Okay? Those are easy. Now, you can also come in on the condyle of the tibia and do what they call unicondylar glides, and basically do a posterior directed force. So on the side of it, and press posterior. Okay. Using the pad of the thumb, and then posterior. And now just try to keep in mind, I know we want to use our hands a lot, but don't forget about your legs. That should be the driving force of your glides, okay? So my hand is here, but try to bring your legs and your body weight into it to make the glides a little bit more effective, but also take some of the stress away from your arms and your hand, okay? All right. Also here you can do a posterior glide. Okay. So stabilize and glide posterior. Okay, bottom. Okay. And feel it. Feel yourself taking up slack and relieving slack in the human space. And feel where the end is. You should be able to feel that easily around this area, okay? All right. And the patella got the person, you really don't have to exert much effort. Your thumbs work really well just to move it back and forth, okay? Some people use the web space to do it with. But that's your superior and inferior glides of the patella. Okay? Now, the head of the fibula. Interesting, I don't mess with the fibula a lot, but sometimes it can come to play. Weird things like ankle sprains, that article that I showed you guys in terms of positional faults, the fibula a lot of times is affected by ankle sprains and can be affected by knee injuries. So it's stuck in a place that it shouldn't be. And in order to reduce reoccurring ankle sprains and instability, sometimes you have to mobilize it. I had a young lady, hers just popped. I mean, it was just popping and it caused her a lot of knee pain. And she didn't even realize that she was hadn't had any issues with the ankle. But when I started moving around her fibula, she had been in therapy for the longest. We did like maybe 2 sessions doing fibula glides and some other knee glides. The popping almost totally subsided. She was climbing stairs and doing everything else with less pain and less frequency of the popping and clicking. So don't forget about the fibula. If the convex concave rule doesn't apply so much, but sometimes just getting in there and moving it into your posterior and superior can make a big difference. Okay? Remember, it's tricky because of what nerve? Okay, so you want to come up around the head of it, and then you can do this one won't really hurt too.
Try to land.
Okay, a little posterior glide there. To me, it's a little bit easier. You mind if I pull your? It doesn't feel good. I promise you.
Stop. Can you feel it there?
This is like a stop. Yeah. Alright. So again, kind of right in there. It's small.
She just came right.
And so it may be easier in some cases to use your thumbs, but in some cases you may be able to use the palm to get to it. I'm having a hard time discerning it with my palm for her. So to me the thumbs feel a little bit easier to get a hold of it. There it is. Doesn't take a lot to make it move, okay? Alright. So let's just do, and you could do posterior, but for the most part on this one, anterior, but for the most part here, we're just gonna do a posterior glide, and then we'll come from the bottom and do superior, anterior, posterior from the inferior aspect of the fibula, okay? So, posterior here, the patella in all directions, the unicondylar glide, and a posterior glide.